This presentation talks about arthritis. It was created by Addie Gillespie, Irene Toms, and Shauna Urrutia. Arthritis is a form of rheumatism, which is defined as any disease marked by inflammation and pain in the joints, muscles, or fibrous tissue. Osteoarthritis is the most common form of joint disease in the world. Other forms include rheumatoid arthritis, fibromyalgia, systemic lupus erythematosus, septic arthritis, reactive arthritis, psoriatic arthritis, and gout. This slide explains the pathophysiology of osteoarthritis. It is a slowly progressive, non-inflammatory disorder of the synovial joints. There is a gradual loss of articular cartilage with formation of bony outgrowths at the joint margins. It's not considered a normal part of the aging process, but aging is one risk factor for developing osteoarthritis. Symptoms are more prominent after 50 to 60 years old, and the causes include trauma, mechanical stress, inflammation, joint instability, neurologic disorders, skeletal deformities, hematologic or endocrine disorders, and certain pharmaceutical drugs. As you can see, the picture on the right shows late-stage osteoarthritis, and you can see how deformed the hand becomes. The clinical manifestations of osteoarthritis are discomfort, pain, disability, stiffness, and crepitation. Crepitation is the grating sensation that's caused by cartilage destruction within the joint cavity. Here in this picture, you can see the beginning of osteoarthritis up to when the cartilage eventually is destroyed. There are no significant lab values for osteoarthritis. However, erythrocyte sedimentation rate, ESR, is normal except during acute inflammation, when slight elevations may occur. Any routine blood tests are only done as a baseline for starting treatment or to screen for related conditions. Analysis of synovial fluid may help distinguish between osteoarthritis and other types of inflammatory arthritis, but there aren't any real lab values that will help diagnose osteoarthritis. Diagnostic tools used to diagnose osteoarthritis include bone scans, CT scans, and MRIs. These tests can help detect early joint changes. X-rays specifically can confirm disease and also staging of the joint damage. Here are a few approved NANDA nursing diagnoses for osteoarthritis. They are acute and chronic pain related to physical activity and lack of knowledge of pain self-management techniques, activity intolerance related to chronic pain, fatigue, and weakness, impaired physical mobility related to joint impairment, and depression related to chronic pain, changing physical appearance, and impaired social and work roles. We didn't include as evidenced by in any of these diagnoses, but they can be any of the clinical manifestations, including discomfort, pain, disability, stiffness, and crepitation. Now we're going to discuss the pathophysiology of rheumatoid arthritis, which is a chronic systemic autoimmune disease characterized by inflammation of the connective tissue inside the synovial joints. Typically, it's marked by periods of remissions and exacerbations. There's often extra-articular manifestations outside of the joints. It can occur at any time of life, but the incidence increases with age, and it peaks between the ages of 30 to 50 years old. It is more prevalent in women than men, and the etiology is unknown, but it's possibly triggered by the genetics and environment. In a nutshell, IgG and rheumatoid factor are involved. Antibodies start the process, leading to an eventual inflammatory response in the synovial joints. Usually, it affects joints symmetrically. At first, it initially starts in a few joints, and it most frequently attacks the wrists, the hands, the elbows, the shoulders, the knees, and the ankles. The onset of rheumatoid arthritis is typically insidious. Nonspecific manifestations such as fatigue, anorexia, weight loss, and generalized stiffness may precede the onset of joint symptoms. Stiffness tends to become more localized over time. Some patients can pinpoint a precipitating event, but research has been unable to directly correlate a specific event with the onset of rheumatoid arthritis. As you can see in this picture, Eventual progression of the disease leads to inflammation and fibrosis of the joint capsule and supporting structures, and eventually may cause deformity and disability. Accurate diagnosis is needed to start appropriate treatment and decrease the risk of disability in individuals with RA. Positive rheumatoid factor occurs in about 80% of individuals with RA. Erythrocyte sedimentation rate and C-reactive protein indicate active inflammation. Increase in anti-nuclear antibody titers are evidenced in about 20 to 30% of patients with RA. Synovial fluid can also be analyzed to determine if white blood cells are present or if the enzyme MMP3 is elevated, which is usually seen in individuals with RA. In some cases, testing may allow an early accurate diagnosis. X-rays alone are not a diagnostic evidence of RA, but they help with baseline disease progression and may help monitor how well treatment is working. Bone scans are better because they can detect early joint changes and confirm diagnosis of RA in order to start treatment. Here are a few NANDA-approved nursing diagnoses for rheumatoid arthritis. They are impaired physical mobility related to joint pain, stiffness, and deformity, chronic pain related to joint inflammation, misuse of joints and ineffective pain and/or comfort measures, disturbed body image related to chronic disease activity, long-term treatment, deformities, stiffness, and inability to perform usual activities. And last, self-care deficit, specifically related to pain with movement and damage to joints. Again, we didn't include any as evidenced by, but these can theoretically be based upon the clinical manifestations of fatigue, anorexia and weight loss, stiffness, pain, limited mobility, inflammation, rheumatoid nodules, deformities, and disabilities. So now over the next few slides, we'll be talking about other types of arthritis. The first one we'll talk about today is gout, which is a type of recurring acute arthritis characterized by accumulation of uric acid crystals in one or more joints. There's usually painful flare-ups that last days to weeks, and then they're followed by long periods without symptoms. Gout is caused by increased uric acid production, reduced excretion of uric acid by the kidneys, or an increased intake of foods containing purines. In septic arthritis, infectious or bacterial arthritis is caused by microorganisms invading the joint cavity either from the bloodstream or from trauma or from surgery. Staphylococcus aureus and Streptococcus hemolyticus are the most common causative organisms involved in septic arthritis, and knee and hip joints are the most often frequently involved. Psoriatic arthritis is a progressive inflammatory disease that affects people with psoriasis. Reactive arthritis is a reaction triggered in the body after exposure to specific GU or GI tract infections. Chlamydia trachomatis is implicated in sexually transmitted reactive arthritis. However, remission is possible with pharmacological treatment. Systemic lupus erythematosus is a multisystem inflammatory autoimmune disease. Arthritis must be present for the diagnosis of lupus, and it needs to involve 2 or more joints characterized by tenderness, swelling, and effusion. For fibromyalgia, it's a chronic disorder characterized by widespread musculoskeletal pain and fatigue with multiple tender points. Collaboration of care is based on the type of arthritis a patient is diagnosed with. However, many treatments overlap. Interpersonal care includes physical therapists who can help a patient understand the balance between rest and activity. Occupational therapy can help patients with the use of assistive devices, such as canes, walkers, or crutches. If a patient is overweight, it is important to refer them to a registered dietitian to help them meet their weight loss goals safely and effectively. Psychological support for self-esteem, body image, and disability are equally important. Alternative therapies exist, including herbs, massage, acupuncture, transcutaneous electrical nerve stimulation, like TENS units, and then also Tai Chi. For drug therapies, salicylates, like aspirin, NSAIDs, such as ibuprofen and naproxen, antibiotics, such as doxycycline and minocycline, and topical analgesics, like capsaicin cream, are used to treat. arthritis. Potential complications can be decreased ambulation secondary to pain and decreased range of motion, leading to decreased strength, functional mobility, and quality of life. There's also an increased risk of falling because pain and stiffness in the joints leads to decreased range of motion, putting individuals at a higher risk for falls. Higher medical costs and time spent in the medical system due to MRIs, physical therapy, joint replacement therapy, infections, the expense of joint replacement surgery, and pain prescriptions can continue to ramp up those medical costs. And another complication is actually with glucosamine and chondroitin. It provides relief for moderate to severe arthritis pain, but doesn't really help for mild pain. But it may decrease the effectiveness of insulin or other drugs used to control blood glucose. Here are references in case you want to look up details on the information we discussed today. We want to thank you very much for taking your time to listen and watch this presentation, and we look forward to any feedback that you have for us. Again, thank you so much for your time, and good luck to you in all your future endeavors.